the current economic times has put a lot of stress on our mind and body.
I'm going tomorrow to visit the chiropractor, and hopefully she can help me with lower back pain and stiffness I've been having. Also, I've been having some pain recently in my hip.
Whether it's working with students, working with patients, or working with general populations, like, you meet somebody on the plane. Well, traditionally, chiropractic has been embraced by the public as something for neck and back pain. And we get excellent results with people who have neck and back pain. But it's the reason why we get excellent results with neck and back pain that is the real benefit of chiropractic. Chiropractic's goal is to look for interference, especially in the spine as it relates to function, and try to find a way to remove that interference without using drugs or surgery. The secondary aspect of what I try to do on a daily basis with my patient populations is to look for any imbalances and try to find a way to restore balance to systems, functional systems, again, without the use of drugs or surgery. Not to say that drugs and surgery don't have their place, but it's always easier to do a more conservative approach and then escalate to the next level of intervention as needed, as opposed to going directly to surgery or directly to drug. As a chiropractor on a daily basis, patients come in, the typical chiropractic patient will come in and say, "Doc, I've had headaches for so-and-so," or "I was in a car accident, a sports injury." Those are your typical patients that most people would consider a chiropractic patient. The patient populations that I've had the opportunity to work with are like patients with Parkinson's disease, because they don't move very well. Their gait's off, their balance is off. So we take a look at their spine as it relates to higher levels of the central nervous system. When I say the central nervous system, I mean the brain and the spinal cord. The spine is just made up of a bunch of bones. Those bones are attached to ligaments, which creates some stability, which restrict motion in the spine. Muscles move the spine so that you can find food, find shelter, and continue to survive from day to day. On top of that, nerves that come out of the spinal column from the spinal cord go to every cell, tissue, and organ in the body. Without that intricate communication process, your body doesn't know what's going on inside, and you can't make the appropriate response